Hi, this video is meant mainly for MBBS and ENT postgraduate students, and I'll be talking specifically only about the instruments required for a procedure called myringotomy and grommet insertion, which usually is done for a condition called otitis media with effusion. So in this condition, what happens is the mother will be complaining that the child is not responding to her call. Means a child, it's common in children above the age group of 3 years and above the age of 3 and around 7 or 8 years. The complaint will be from the mother or from the school that he is not attending. He has got a hearing loss. So what happens is, in simple terms, there will be fluid accumulation behind the ears. As you see in this picture, this is a drawn diagram where there's a fluid level and there is fluid which is glue-like, seen behind an intact tympanic membrane. Actually, this is a drawn picture. If you see the next one, I have taken a photograph. This is a picture of a tympanic membrane where it's not a normal tympanic membrane. Here you can see an air bubble. Likewise, you can see another air bubble here, and there's a fluid level. There's a fluid here. So this fluid has to be taken out. So what we need to do is, we have to put a small incision and we have to put a grommet there because there is no proper aeration. So I will be speaking mainly about the instruments. There were days when we used to do under microscope. Even in my days, about 20-25 years back, I was trained to do these procedures under microscope. This has been totally replaced with endoscopes, transcanal endoscope. So here you have a camera, high definition camera, and an auto telescope. The auto telescope is about 10 centimeters in length, and you have in different degrees. The light which shines from here, you have in 0 degree, 30 degrees, 45 degrees, and 70 degrees. And the width of this is 4 millimeter, or it can be 2.7 or 2.1 also. The one which I use for pediatric such procedures, I use about 2.7. And there's a color code also for this. And the main two instruments are, one is a myringotome to put an incision, and second one is a crocodile forceps to hold the grommet. I'll show you about that. So in this, I'll show you each. This is an auto telescope. It is written as 0, and there is a green code also. You have all the small suction, different varieties of suction, so that we can suction out the glue-like thing. Here is the high definition endoscope, and this is the myringotome. With this myringotome, we can make an incision. The tip of the myringotome is very sharp, and the both sides, diamond shape, it is blunt. These are the crocodile forceps. These are small suction, and this is the grommet which we are going to use. So the grommet, it comes in 1.14 millimeter. There are at least 100 different types of grommet, but generally we have 3 different types of grommet usually available in the theatre. Now, this is an endoscope, high definition endoscope. First we need to focus and get a very good high clarity. Once that is done, we'll do a white balancing. See to it, you do it properly, get it done properly. And once that is done, focus well and white balancing is done, we'll first examine the ear. If there is any wax, usually it is done prior to the surgery, prior to the day before surgery, but it's always better to have a look. So here I'm having a look of the eardrum. Though in this camera it looks like red, actually because of the light is over focused, so it's looking like that. So with the microtome, without touching the side, I'll make a small puncture in the anterior inferior quadrant. See, I made a small puncture there. Now, with the tip of there's just one drop of blood there. It's bloodless field. With the tip of the myringotome, I'll enlarge the opening. Now, this is a grommet, this is the outer flange, this is the lower flange, and what you see the extended one is called as the shoe. So, with the help of a crocodile forceps, we have to hold the upper flange in a proper way, like how I am doing here. Then slowly, without touching the sides, I'll slowly negotiate the shoe into one of the openings of the perforation which I have made in the tympanic membrane. See what the shoe has gone into the opening. Then take a straight or angled pick and slowly push it from the lower flange. Push it inside into position. It sits in tight in the anterior infant con. That's it. Now the procedure is done. It is as simple as that. It hardly takes 2 minutes. The main instruments for a endoscopic procedure is we need a camera and the whole equipment for that. And the instruments, as far as the instruments are concerned, it is a myringotome and we have a crocodile forceps. So in a diagrammatic way, I have shown the myringotomy incision anterior inferior quadrant for a case of otitis media effusion, aspiration of the secretion which is glue-like, then slowly positioning the shoe of the grommet into the perforation made and position it completely. That is what I have shown. This is the instrument. The instrument is myringotome, the sharp tip, and these two sides are blunt. It has got, this is a tip, this is a handle with small grooves on the other side so that it can hold properly. There is an angulation and this is called as a shaft. These are the different parts of a myringotome. Now we have a crocodile. These are the ring handles. This is called as a shank, and we have a locking system here, and there is no ratchet. And we have to, with the crocodile forceps, we have to hold the upper flange of the grommet. So in this video, I am talking only about the instruments. Thank you so much.